Hello everyone. Today is another lesson which we need to know. And what is this lesson? It's all about staffing. Staffing is the second factor in organizing, is the mining of jobs and the department known as staffing. Staffing is finding, selecting, appointing, and placing people to do work as the definition implies. It aims at ensuring that the personnel placed in a particular job are suitable in terms of ability to perform and awareness of the role behavior appropriate for the performance of the assigned tasks. The nurse manager should place people to the job according to their potentials and capabilities. The objective is to put right person on the right job and the right time, and that will take us to establishing a working relationship. How do you go about that as a staff or as a manager in an institution? This involves establishing working relationship among the job to be done, the people to do it, and the authority required to carry out the job. In other words, it simply means delegating responsibilities or role to the person engaged and giving the position holders authority to do their job. It is authority that gives meaning to the departmentalization or structuring and then mining aspect of an organization. So the three activities in organizing are to intrinsically related as to be inseparable. They produce the hierarchical nature of organization and establish the superior and subordinate relationship by which managers do things through and with others. The superior guides the subordinates to ensure that they perform their duties in accordance with the objective. This is also known as coordination. In summary, organizing is a system that allows the personnel to function and attain the objective of the establishment or the unit. So organizing helps the nurse manager to do the following. 1. Determine staffing pattern of the nursing department, the kind and the quality of care required by the patient, the number and the position of staffs, and the scope and responsibility to be assigned to each staff member. It also involves selecting and maintaining qualified staff members, carrying out continuous recruitment program, and placing individuals on the right job at the right time. It is in organizing that the nurse manager identifies and develops programs for her staff. Example, we have orientation or induction and in-service training. Organizing helps to plan realistic personnel policies that allow for job satisfaction. And that will take us to the next process, which is supervisory process. Supervision is a management function which is very important. It is the act of overseeing, observing, and assessing performance of workers in all the activities to ensure adequacy of standard and achievement of objective already stated. It is a process of helping the subordinate to improve on her knowledge and skill through objective monitoring of her job or work performance to ensure that one delivers the best possible care to the client. Therefore, sufficient clinical competence is needed at each level of teaching, directing, and evaluating the activities of the subordinate. Directing and evaluating the activities of the subordinate. A good supervision means creating opportunities for people to perform what they already are committed to perform. For supervision to be thorough in any healthcare setting, either may be in the community or the hospital, the following techniques must be applied. Number 1, objective must be properly stated and committed to every member of the staff. Job description of each category of staff must be clearly noted. The supervisor should develop uniform supervision checklists or criteria for each type of service rendered, and he should be physically present to monitor work performance of the staff. Supervision should be carried out during and after each procedure to ensure that workers do the right thing at the right time in the community or an organization. And the supervisor should occasionally pay unscheduled visits to health centers or posts to ensure she sees the workers in their nominal or normal behavior. And that will take us to the next thing. Human relation in supervision. How do you carry out human relation in supervision? The successful supervision must possess certain personal qualities. Number one, the supervisor, she must command respect and loyalty from workers in order to ensure maximum efficiency in the work. Number two, she must develop ability to know how to treat subordinates as human beings. She should not be too intimate with subordinates, because with intimacy it comes legacy, and with legacy comes the loss of respect. So you try to limit the way you interact with your subordinates. The next one, she should not be too strict. She should elicit the cooperation of her workers. The supervisor should be a leader and not a boss. Impartiality, open-mindedness, and fairness are required of the supervisor in dealing with everyday problems which at times threaten to disrupt the efficiency functioning of the world. The supervisor must be ready and willing to see both sides of the problem and also try to solve them fairly and reasonably so that no rancor remains in those against whom the decision goes. The supervisor must be available for advice when approached by the subordinates and must be patient and show understanding in dealing with personal problems. Finally, a good supervisor should be able to keep her promise or promises to staff. And that will take us to the benefit of supervision. What are the benefits? Number one, supervision helps in overseeing planned activities. 2, help in achieving stated objectives. 3, helps in maintaining staff morale and confidence. 4, helps to provide technical assistance where and when necessary. 5, identify training needs for workers. 6, provide prompt feedback for improvement of job performance. 7, help the supervisor in evaluating the program and also taking corrective action. Number 8, encourages adequate communication between the supervisor and the subordinates. The next lesson we will take also is quality assurance and performance evaluation. We have been hearing this word, quality assurance, and even in school we have them come around to ensure that everything is in place. Yes. What is quality assurance, as I might say or ask? Quality assurance are mechanisms employed to ensure that standard of care is established, accepted, and constantly reviewed, and threats to organizational survival prevented or reduced. Quality assurance refers to a system for monitoring outcome of professional interventions and departmental activities compared with established standards to evaluate and document appropriateness and effectiveness of practice. Quality assurance efforts neglected a desire of professionals to improve practice. And that will take us to the tools. What are the tools for quality assurance, especially in nursing? The principles behind the rule of ensuring the provision of quality services and the focus on quality patient care cut across all disciplines in healthcare delivery system. Many healthcare researchers are now attempting to define, measures, and evaluate healthcare. The Hospital Quality Assurance Program evaluates the quality of care for one stay in a hospital as clients or patients receive care concurrently from several different providers. So patients are now requesting value, quality care for their money. So while healthcare providers are asking for wages, which justify the amount of work done, hospitals are now being run as business centers. Quality and quantity of care is now being given due consideration in any discussion on productivity. The various departments in the hospital are looking into efficiency and effectiveness of the operation, that is, activities. The radiography department is now only concerned about the number of x-rays they can produce in 1 hour, but the quality of their film must be of diagnostic assistance to surgeon. Nursing is also determined to give quality care and to reduce complications among patients in our hospitals. What are the tools to carry out this? To carry out quality assurance. Number one, we have nursing ethics and the laws affecting nursing practice. Number two, nursing process to give an individualized care. Number three, nursing auditing to measure nursing services. Number four, we have nursing research to develop nursing theories. Number five, seminars, conferences, and workshops which stress multidisciplinary approach to care. Example, middle management course, 4-week certificate course on emergency planning and preparedness, computer application course. And that will take us to the role and responsibility of a nurse manager in quality assurance. What are the roles? Morning managers, among other duties and tasks, maintain constant contact with clinical practice, which is very important. So today, healthcare calls for the services of mature professionals with considerable wide range of clinical experience and solid educational backgrounds. Alongside the development of nursing, the role of the patient has also changed dramatically. No longer are they the passive recipient of care, but informed, questioning people who want to be central in the decision about their care. So the nurse manager should therefore be a great leader who is able to visualize this innovation and implement them. The nurse should have the responsibility of managing everything that affects the nursing of patients and ensure that staff maintains quality care. She will lead clinical nurses, maintain professional standards through discipline, and manage the capital program, logistics, and finance. Quality care is, as practiced by Florence Nightingale, should be adhered to Florence Nightingale ensure that nurses keep patients clean, give clean clothes, and give them necessary psychological support altogether with their relatives. Nurses in general must be able to measure the care given through their knowledge of the nursing process. Nurses are professionals, must care through assessment of patient problem by observing, talking, listening, and discussing with the patient, planning to meet their needs and solve the anticipated problems. Through care planning, implementing the plan and evaluating the care given by observing and discussing with patients' families, and the nursing teams, the need for accountability in nursing practice and the need for evaluating care given are paramount. So nurses have a lot to do when it comes to quality assurance. So what are the major rules, or how the standard of patient care in the world can be measured? How can we measure the standard of patient care in the world? This can be done through evaluation of the following. Number one, are the objectives of the hospital being met? Are the objectives of the hospital being achieved? Are the targets set for the nurses being achieved? Are policy being adhered to? Are laid down procedures being carried out? Are the aims of care being met? If the answer to the above questions are negative, what can be done to improve the situation? When you answer those questions that I've just asked as a student or as a nurse, it means you're meeting your quality assurance. So the next caption here, we have parameters for evaluating quality assurance. The following parameters may be used to evaluate quality of care given. Number one, the rate of recovery. Number two, the rate of wound healing. Number three, incidence of wound infection. Number four, development of pressure areas. Number five, occurrence of ward accidents. Number six, attitude demonstrated by patients and or relatives. Number 7 or 8, the general remark or impression by the public. That will determine the parameters for evaluating quality assurance. So with the above, evaluating quality assurance, if you are a student or a nurse already, all these ones, you see them on the patient faces, because they will smile at you, they will clap for you, they will commend you, and they will pray for you. So you also know that, yes, I have met the parameters for evaluating quality assurance by the people who look at you or the entire public. And that will take us to the next step, which is tool for measuring quality of care. What are the tools? We have various tools for measuring quality of care as it has been developed in the United States of America. These tools have enabled the nurse manager to, one, assess the staff required for any ward based on the patient's needs. Example, personnel required in the spinal cord injury ward. It has been shown that quality of care can be improved if the staffing levels are correct. Number 2, assessing the number of hours needed per shift. More hours may be needed in a pediatric unit or the theaters. Number 3, the materials needed in a busy orthopedic ward, more materials might be needed. So these are the tools for measuring the quality of care that a nurse will wish to carry. What is the effect of quality assurance program? To be effective, quality assurance program of any hospital or organization should be based on the following parameters. Number 1, recruitment, employment, retention of qualified personnel for direct patient care. Number 2, adequate staff. Number 3, supplies of adequate material. Number 4, better management of processes. Number 5, wages and welfare packages for the staff to ensure provider satisfaction. Number 5 or 6, incentive in form of promotion or recommendation for achievement. Number 6, the use of modern informative or information system for effective communication. Example, we have telephone service, intercom, email, computers, and internet facility. They are all important. Number 8, the use of labor-saving technologies to support nursing care. Example, we have electrical turning beds, water beds to relieve pressure areas. Number 9, we have involvement of all professionals in the health sector in policy decision making at the administration or managerial level. Number 10, exposure of staff to continuous education through seminars and conferences. With this, they will have an adequate knowledge to transfer learning always. Number 11, financial support for research to improve patient care. Most institutions, this is where they are lacking too. They find it very hard to provide money for staff to go in for conferences and seminars. So we should try to do that as leaders who are found in the organization. Also have exposure on personal management and financial management, including budget preparation. Budget carries everything. If you don't have money, you cannot do anything that has to do with organization. So budget is a main important issue here. Whatever you're planning, if you don't plan and included money, then you are nowhere to succeed. So the last one here, we have provision of ward-based domestic housekeepers, clerks, and other support staff. They are equally very, very important because you cannot do everything on your own part alone. You have others, you have sweepers, you have gatekeepers, you have security people to keep that flow. Whenever all these things are in place, then the organization will take off very well. Our next topic is planning of health services. You've been hearing about planning. How do you go about it? How do we plan our health services? By definition, planning is the first element of management. It is a prerequisite for other functions of management. And I ask again, what is planning? It is a predetermined course of action to be taken so as to provide purpose and direction. It is a process of analyzing a situation, making forecasts, and arranging a plan of action to meet set goals and objectives. It is also the process of setting objectives and determining the course of action to be taken in attaining them. It also involves laying down activities, trying them to a time frame, assigning them to people, specifying method of sourcing for, and allocating necessary resources for achieving the goals. Planning can be explicit, and also this include the following: forecasting, that is projecting the future; policy formulation and objective formulation; decision making; division of labor, that's job allocation; and job description. And that will take us to the advantages of planning. What is the advantages of planning? Number one, planning ensures effective use of available resources for effective implementation of organizational policy and achievement of organizational goals. It also involves rational decision making. It is an essential for efficient accomplishment of tasks because it enables us or one to know what to do, when to do it, how to do it, and what to do or what to use in doing it. Planning ensures identification of possible future difficulties before they arrive. So if you are good in planning, you will succeed as fast as possible. And we have said it. Continue from where we have stopped. The planning may be long term and also short term. But we have to talk about the long term first before going into short term. In long term strategic plan, these are broad plans. Example, we have vision 2030. What will be your vision in 2030? They are usually made by top management and board members. Strategic plan enable management to anticipate difficulties and take steps to solve them. They give more clear picture of activities of the organization. Long-range plans are broken down into factual plans. They must be reviewed periodically in order to modify or change things as necessary. And that will take us to the short-term operational or tactical planning. Short-term involves, example, daily planning, weekly planning, monthly planning, biannually and yearly. These are made by departments and units. Such plans may be program routine or on program, resulting in new high-risk decisions to solve problems. So what are the steps in planning? Number one, collect and analyze data on the situation. Number two, identify the needs. Number three, define objective for meeting needs. This objective must be prioritized and criteria for evaluation set out. Lay out possible strategy and alternative for obtaining the objectives. Critically analyze or do a forecast or evaluate the alternative courses of action in terms of costs, benefits, risks, probability of attainment. And also choose the best alternative. After laying them down, choose the best alternative. Source for and provide needed resources both material and human. That is the steps in planning. Then what are the principles of planning? Planning should be based on clearly stated objectives that conform or confined with the policy. Be precise and simple to operate, flexible and balanced. Plans should have time frame and then have a cost frame. Make room for unforeseen difficulty and human error. How then can planning help the nurse to meet her points of needs? Plan can help the nurse to meet the points of needs. To ensure planning abilities, there are several qualitative methods. There are several qualitative methods or quantitative methods that can be used. This involves the quality of plans and assigns the planner to systematically search for effective resources and strategies to ensure realistic attainment of objectives. They can be used at any stage of planning. For example, during stage of policy formulation and decision making. The dive technique is used during strategic planning, PEC, MBO, PPBS, and dive are used. And during tactical planning, mini PECs or PPBS are also used. All these have meaning, and when you go into your book, you'll see what I mean by PPBF or MBO and all of that. All those terms are there in your book. So find out. These qualities methods are aid exploration of objective leading to rational decision making. It also ensures that dynamic planning are successful. It ensures identification of possible constraints in future before they occur. They involve long evaluation and feedback. They also reduce uncertainty and also make plan explicit and anticipatory. We have also finished planning, and then we go into the qualitative or quantitative models. Under quantitative models, we have management by objective. In our previous lesson, we have talked about that. So this is the main topic we are going to look into it. Management by objective. So that in anything you are doing, whether if you want to go to the market to buy your soup or soup things, you need to state those things that you have. Those are your objectives. And you may not exceed that. So that it will now conform with what you have in your pocket to be able to, carry out what you want to do. So management of objective is strictly on your own stated objective. You have stated them and you cannot deviate from what you have stated. So by definition, management is a process of getting things done through people. An objective is a destination, a goal, an expected outcome that people work towards. Objective planning plays implementation role in management because it describes results. Management by objective also involves focused attention, direct activities of group, aid to implementation and evaluation of plans, projects, and performance. A good manager involves developing a system of objectives that will focus on the attention of workers, on the organization. It must be meaningful to staff and not conflict with their personal goals, but rather contribute towards satisfying personal goals. Definition of management by objective goes further. It is a performance appraisal system based on objective. It is a planning strategy or technique whereby goals and objectives are laid out. The best action put in place to attain the goals and strategy for evaluation are laid out or lined out. By this concept, evaluation of staff activity is based on how well these activities lead to the attainment of organizational objectives. It therefore utilizes the advantage of objective of management. What are the advantages of setting objective? Management by objective was developed by Peter Drucker, but made popular almost 20 years later by George Ojomia. It is close in principle to planning, in both objective are set, programs of activities laid out, implemented, evaluated based on objective. MBO ties activity and resources to objective. It is a comprehensive process, yet easy to understand, and can be operated at any level of the organization. It is a logical and effective system of management, thereby both the superior and the subordinates together set up a common goal. Delegate areas of responsibility, define expected results, and use it to assess the contribution of members. And that will take us to the principle governing management by objective. Objectives should be supplied to every area where performance and results are necessary. Objective must be clearly stated in a definite terms of expected results and time frame. That is, they should be spelled out in a qualitative terms by describing what is to be done and when they should be accomplished. Clearly states the objective as a foundation for performance and specify evaluated standard. However, some objectives do not lend themselves to qualification or quantification. For example, public relation goals aim to improve the image of the nursing profession, but they are difficult to quantify. So each employer or employee must focus on definite and measurable results or outcomes that have clear meaning. Goal setting should conform with the following rules. Number 1, goals should be progressive and innovative, not routine. The right goals should be chosen. Goal setting should be participatory. So in whatever you're doing, be able to participate. And when you participate, you understand it more, not paperwork. And that will take us to the steps in management by objective. Management by objective involves certain steps known as organizational policies and goals. Identify department and unit goals that staff are to pursue for an assigned period of 1 year. They must be in line with the goals of the organization. In the surgical unit, for instance, having to identify the nursing department goals, unit objective for the third quarter of maybe 2025 are set out jointly by the unit manager and her staff. So such goals reflect the typical activities of the unit. For instance, to ensure that 50% of the surgical wounds heal at first intention by the end of the quarter. The set objective must 1. Be consistent with organizational expectation. 2. Be defined in operational terms. 3. Be visible and achievable. 4. Be tied to a time frame for achievement. 5. Be challenging yet not over optimistic. 6. Be progressive in growth and improvement. Therefore, before setting goals, ask yourself the following questions. And what are the questions? Number 1, do the objectives cover the main feature of my job? Number 2, are they verifiable? Number 3, are they within the limits of achievement? Number 4, are they consistent with overall goals? Number 5, are resources sufficient for achieving them? Okay. And that will take us to the next benefits of management by objective. What are the benefits? In anything we are doing, we expect benefit, even as individual, not to talk about the institution. So they need benefit. So what are the benefits of management by objective? Management as a modern management technique has many benefits to both the individual workers and the organization in general. Management by objective encourages full participation of all in decision making for policy implementation. The worker's full participation implies high commitment because he is given the freedom to select the means for his goal achievement. The authority and the autonomy given him to select the means of achieving the goals is motivating and also encourages innovation. So this in turn enhances the worker's self-development. That since the amount of work to be done by the worker and the time span are determined, and the worker, through the statement of commitment, really work towards achieving the set goals. Management by objective helps to ensure that the worker is rewarded according to his inputs. That means that there is an adequate and commensurate reward for the worker. Joint responsibility and statements of commitment by all reduce the need for crisis management. Critical incidents, stress is minimized, and conflict arousing situations are therefore not common here because each member understands the other and all perform coordinated roles and also attempt to reach the goal at a stipulated time. On the basis of coordinated activities, management by objective ensure adequate control of the organization operations. It ensures that all hands are on deck to achieve the earlier stipulated objective. At the same time, management by objective reduces the need for directing and controlling by ensuring individuals to decide on the means to achieve their objective. So management by objective enhances free and adequate communication, accountability, and reporting in the organization. The statement of commitment brings about the need for full accountability for actions taken. The fact that all are involved and carry along throughout the process of planning and implementing makes reporting obvious and easy for those concerned. It integrates individual needs and also organizational demand so that the individual in performing His organizational role is motivated by the fact that he will gain some personal goods through its expectancy valency theory of motivation, which was also written by Varro. Finally, it also gives direction and structure in the organization through specific goals for specific workers and units. So each person readily knows to whom for what he is responsible in the course of performing his predetermined goals. And that will take us to the impediment to management by objective. What are the impediments? Although various advantages of management by objective has been identified above, it also still have some chances of failing to achieve its desired goal. Several factors may be necessary or responsible for the failure to achieve the benefits of MBO. Some of these constraints are examined here. Number 1, setting attainable or realistic goal is not as easy as it sounds. Very often, lovable objectives are developed, but in real practice, one discovers that the seemingly fantastic goal set is never easy to accomplish, resulting from several factors. Human and material, it is easy said than done. Goes popular saying, a look at a national policy on health, for instance, will help you understand this. Though very articulate, this policy has experienced many setbacks, such that its realization in many parts has not been possible. So when an objective is too easy to attain, it may not worth the need for validation and mobilization of resources. In this case, the objective may be taken for granted in many aspects and may not be achieved at the end. Therefore, the issue of validating said objective possesses a great problem very often, so that sourcing all the possible means for validation of the object or objective as a working material may become frustrating, and the objective may be discarded or abandoned. Therefore, when the said objective conflicts with institutional policy, there is likely to be conflict at the implementation stage. So to avoid this, the institution policy must be put into consideration at the second and the third stage of MBO when the objectives are being developed. So since the coordination or since the subordinate is involved in setting the goal, the superior may hold him accountable for action, particularly when the things turned the other way round. There should be a shared responsibility for both success and failure, and the need for reassessment determined by all concerned. Therefore, in conclusion, MBO stands as a technique of involving both the superior and the subordinate in the identification of needs, establishment of goals, and also the actual implementation of plans through the statements of commitment. The worker should be motivated to put in his best in performing the stated tasks and should be given the opportunity to exercise his ingenuity in task performance so far. It does not contradict the laid down organizational policy. Effort should be put to control the demerits as much as possible so as to increase his stability. That will also lead us to another fantastic topic. Here we have planning, evaluation, review technique. PEG, as the name implies, is a probability planning model which seeks to reach goals and objectives within the shortest possible time through work rescheduling. It is based on networking or graphic presentation of the work sequence to be performed. It implies time facing the plan. Example, we have phase 1 to 2. For the purpose of effective control, it is designed to forecast and also control achievement of objective in the estimated time. The network is made of events and activities. An activity is the start or the end of the activity. This does not consume time or resources and is merely a point in time. It is presented by circles and numbers, so that when you go into your book, you will see that circle. You have here circle 1 and 2, and you have an arrow that shows A at the center. So that will bring us to the activity, trying to describe the activity under it. Activity here is, activity is an operation, job, or task. It consumes time, energy, and resources. Each activity is given a time of completion, which is written below the line signifying the activities. Example, we have here, under the activities, you have 20 minutes. This is one event and one event 2. So all are being written in your textbook for you to have clarity. So when several activities converge on the same page or events, the one with the longest part is taken. So this is here we have 45, where we have the longest part. The next part you have 30 here, that is signifying C, and 20 here is the start and the other side. So that is how it is. You might have so many rules. So what you have to do is take the longest part first, then the other one will be very easier for you to carry them out. So the example that I've given out with my explanation will allow you to understand what we mean by that. Example of an activity here we have is, which I have said here. However, some activities do not consume time, which I've already said. These are called dorming activities. They are dependent activities of those that run concurrently with the main activity. They are represented by broken arrows. An activity is represented by a letter arrow joining two events from the left to right. This is the one that has 1, 2, 3. They are all under events, while the one with is an activities. The one with capital letters are activities. So you see them there. So based on that, based on the PEG, we have steps. What are the steps that are involved in carrying out PEG? Number 1, we have defined the project objective. List all known activities necessary for the project. Order them as they proceed or succeed one another. Then establish how long each activity will take. List resources necessary for each activity. It's like maybe you wanted to build a house, and in that house you cannot just start everything at the same time. So you define, by the time you're able to define the objective, and then you list all activities that are necessary. Maybe you need a land. From land you need to survey them. You know the steps in carrying out how to build. So that is the same process. You have to finish one step at the other. You don't just start everything at the same time. But I know that there are many people who has money to do that. This other one, even if you have money to do that, you must complete one first before you start up another one. So that is a PEG for you. You carry it step by step so that you don't make mistake. So construct network and establish total project time. Yes, find the critical part, that is part within the longest time. Yes, What will be the longest time for you to carry out the pass? The first thing is maybe when you want to look for a land, you want to look at the sites. The site, is it motorable? Is it near town? Is it in the bush? What are those things that you want to actually look out for in a land? So that might be the longest part for you to take before, because every other thing is there for you to use money to do. But the most important thing is for you to look for the land. Who owns the land? Because there are some land that maybe about 10 people must have bought that land. Going into it might be causing your debts, because you have actually not asked well. You have actually not gone to the land and surveyor to inquire if somebody owns that land or if another person has bought that land. So those are an example of, the longest path for you to start up. So when you have a land and you own it, every other thing can follow. And that is it. And we also have a typical example of a PEG process. How do PEG process goes? PEG process actually is what you cannot make a mistake. You follow them step by step. And we are going to use a routine check of what we do at home before leaving home. We have here, it is actually used for capital projects, but it can also be used routinely. Example, on a typical working day, here are the activities that Ms. Atom, an unmarried business executive, engaged in. Number 1, alarm rings, then get up and dresses the bed, run to bathroom, brushes your teeth, take your bath, get dressed up, boil water for tea, cook breakfast, make tea, take breakfast, read through appointment for the day. Therefore, she locks the door and leaves the room. This is a typical example of a day-to-day of what we do. And there's no how you can, wanting to go to work without locking your door. So you make sure that those things you remind yourself of doing those things before you. So that is an example of PEG. Whatever you're doing, you're not doing it to make any mistake. You are doing it to complete it totally and know that, yes, you have achieved something. Going further, you will see a diagram here if you have your book that has to do with the construction of network based on the events. So with reference to this network, which is figure 9, it is important to remember that events are represented as O when you look into your book, and activities are represented as arrows. You see them here. So event 6 in a PEG network is represented as 6. Event 1 is a start event of activity. A and B. Event 3 is the end or a head event of an activity. A and C, while event 2 is the end or a head event of an activity B. The arrow heads are at the completion of an activity. Activity D cannot start until A has been completed. In the same way, event 8 cannot start until activities J and K have been completed. Activity D is entering event 4. Thus, activities E and I are dependent on activities D. In this network, activity D is a predecessor activity to event 4, while activities E and I are the successor activities to event 4. Processors are entering activities, while the successor are leaving activities. Event 1 has no predecessor, is on its own. Therefore, when the major events and activities are well thought out, and the line and the time for each properly estimated, it will be possible to estimate the longest path in the network or the longest time it will take to complete the last event of the project. The critical part is fixed by the longest chain or the longest path or route. The largest time is the critical part. It is important to remember that there are usually more than one way of arriving at the solution to a problem. The school manager is the one to decide which route to follow based on available, dependable, and scientific data. Looking through these pathways, this is also showing you that in your situation, in anything you're doing, just one way alone cannot solve your problem. Somebody might be in London, Abuja, while you are here, and he tries to solve your problem because of meeting one person or the other. And at the end of the day, you accomplish your task. So that is a brief explanation of what PECS is all about. PECS does not miss out. You must complete your task adequately. So using one form cannot solve the problem. You might use several other points to solve your problem, and that will make it faster and easier for you. And that will take us to the advantage of PEC. What are the advantages? Make planning logical and complete by breaking work into operation and emphasize job sequence. Yes, you have seen it there. This one carry A, D, C. They are into sections, whereby even some other person can help you break them, and then you achieve your goal. It communicates plan, time, and flow to all involved. People are involved, and they will make sure that they help you out of the problem that you have. PEC helps to achieve planning principles of action, commitment, because it imposes discipline on all concerned. So those who are part of that policy or that organization, they are all well disciplined, and they will make sure that they have focus. They will make sure that they deliver. They will make sure that they do everything that it will take them to make sure that that organization succeeds. It also helps in realistic planning through logical sequence of activity. You know what it means? Logical sequence of activities. Everything comes in sequence. Everything is in steps. If the other one does not finish, this one will not move. But they all have like minds to complete the task. It also helps in placing a plan for effective time control and avoidance of unnecessary delay. Yes, they look at their time to say that, oh, this is the appointed time we are supposed to complete this, and they work towards that. If they know they cannot do it, they bring in more people to make sure that that time is not delayed. It also ensures maximum goal achievement because it removes omission and limitation, just like what I have said before. Anything like omission and limitation, they are not part of it. PEC is not part of it. PEC wants to do everything to make sure that those taxes or those tasks given has been accomplished. And that will take us to the disadvantage. In anything we do, if you have the advantage, the disadvantage is also there. And what will be it? PEC does not concern himself primarily with costs, but with time. They don't look at the cost, but with time. Time is their own disadvantage here. If the time is not on your side, then you are not doing well. But everything that has to do with the cost, they are ready to pay. So PEC does not concern himself primarily with cost, but with time. It's not a practical for repetitive tasks. However, the mini tasks may be used for such plan. Yes, it is not practical for repetitive tasks. They can't do anything and say, I want to go back to do this. Just like when you want to build a house. Follow it step by step. At the end of the day, the thing will stand. You cannot go back and say, oh, I didn't put this. That's why it is step by step. Put everything together and make sure you accomplish it. The mini PEC may be used for such plans. So, mini PEC that you know that you have time to complete them, and you follow them step by step, you may use that. And that will bring us to the end of this class. Maybe by next class, we'll look into planning program budgeting system, which is PPBS. Thank you for listening. God bless you. Okay, going further, planning program budgeting system. We start by planning, which we have rightly said already, but this one has to do with PPBS. It is a predetermined course of action to be taken so as to provide purpose and direction. Programming, it is the definition of materials, financial, and human resources which are necessary for the successful achievement of target. Budgeting, which is the almighty. This is the conversion of program into budgetary or monetary terms of annual proportion for effective accomplishment. PPBS, it is a program-oriented concept that harmonizes strategic long-term planning with tactical short-term budgeting. It is therefore helps the planner to tie both operation and resources allocation with objective. It is used for effective scheduling of work and resource allocation to achieve such goals. It is useful for non-program decisions and goals. Therefore, PPBS emphasizes output of program and encourages specific or periodic evaluation of performance. The main purpose is to provide an improved framework of information analysis to enable decision that will achieve set objective to be reached. What are the advantages of PPBS? It emphasizes forward planning. It also improves the efficiency with which public funds are utilized. PPBS brings together planning, budgeting, and rational appraisal of outcome. PPBS ensures that plans and programs achieve the organization's objective through rational resources allocation. It also helps to set up budgetary control. What are the disadvantages? Sometimes it is difficult to establish selective criteria. PPBS involves, number one, establishment of a system of budget, clarification which relates programs to target and function. It establishes an appropriate relationship between long-term and short-term range plans and identification of the segments of the plan to be implemented within the factual or visual achievable in short-term budgets. It's also a system analysis of alternative to aid rational choice. Such analysis include qualitative factors or quantitative factors. Qualitative factors like political factors, economic factors, and social justice. Quantitative factors include cost, benefits, time, utility, effectiveness. Number 4, an elaborate plan for action to be accomplished during each phase. The resources required, the timing of the results, and the means of regular monitoring. Number 5, evaluation of plan as it is implemented to ensure that results are set objective. What are the steps in PPBS? Formulate ultimate goal. Example, we have assess and identify needs. Identify resources and constraints. Also develop specific objective program. This must be measurable. Develop program structure, activities to be performed, or alternative by which objective may be attained. Do program analysis. Analysis durations, financial costs, time costs, opportunity costs, available resources, benefits, and effectiveness. You go a long way to help. So also have a diagram here that can be very, very meaningful to you. Here we have project objective, we have a program structure, we have program analysis, and also program plan. And all together will give you program evaluation. You'll be able to evaluate whatever plan you're doing. So development of program, you have developed a program plan or budget and allocate resources. There is need to develop an overall budget and a fiscal budget. Under program planning, activities to be accomplished during each phase and resources are required and also listed below. Program evaluation inbuilt in the PPBS model is evaluation of plan as it may be implemented. Put everything in plan and then showcase what and what you have to do, and they have to be in steps. So I have to give you an example of PPBS. Example of PPBS. Number 1, here we have high number of HIV stroke patients in the hospital. What are the steps you want to carry? Number 1, organizational goal to ensure safe patients' healthcare. Whoever comes to the hospital should be safe by coming to that hospital. You make sure that every other thing that we want to apply to that patient is sterilized, and also make it good to prevent cross-infection. Step 2, identify needs. What are the needs? Example, need for training of nurses in preventive patient care. Nurses need to be trained. Need for extra autoclave may also be identified for sterilization of equipment and material. Need for mold dressing for the pack system. Yes. So you don't need to use one pack to maybe so many patients to avoid cross-infection. The third step here, we have develop specific objective. What will be the objective that you want to carry out? To treat all patients as prospective HIV patients, to screen or determine HIV status of all patients, to train all nurses on preventive patient care. All the above objectives are to reduce work-related AIDS infection by 90%. So these are the things that you laid out for one to know that yes, you are actually serious to carry out this PPBS. So the step 4, program structure. What will be your program structure? Here we have continuing education, training of nurses. Nurses should be continuously be trained. Determine HIV status of all patients. Then autoclave all instruments. Whatever instrument you are using at this point of the day, because everybody is a suspect. You need to autoclave them so that you don't carry out what other person will have suffered. Step 5, we have program analysis. This also involves analyzing all the activities listed above, and then opportunity cost of all the activities and available resources like continuing education. Teachers are required, payments of salary or teachers, space needed, finance also are needed, materials, list items, and then costs, the duration of course, give cost always. So this last step, which is step 6, program plan. You draw out your fiscal plan. If to last 1 year, fiscal plan is monthly. If to last for 5 years, the fiscal plan should be yearly. So I have an assignment here for you, and that will bring us to a close. Carry your pen and paper and then draft this assignment. Assignment 1. The problem of a certain unit is said to be poor performance of students in nursing and midwifery council. Using the PPBS model, show your plan or program to solve this problem. And that will bring us to a close today. Thank you for listening. God bless you.